Hi, I'm an OT, and today I will be checking in on one of our patients, Margaret. She is 63 years old and is recovering from a stroke. The assessment we will be using today is the KATZ Index of Independence, and we will be assessing 6 basic activities of daily living, including bathing, dressing, feeding, toileting, continence, and transfers. This assessment is both a reliable and valid approach to assessing functional independence. It is extremely beneficial for chronically ill patients and seniors experiencing age-related changes. Hi, Margaret. How are you doing today?
I am just well. Thank you for asking.
My name is Caroline, and I'm an occupational therapist. I will be running through a few activities with you, if that's okay.
Yeah, that's all right with me.
All right, Margaret, for our first activity, I'm going to have you get up, walk to your closet, and pick out a shirt and pants, preferably a shirt with buttons or a zipper so I can properly assess you. Notice how Margaret was able to select, collect, and dress herself independently. She even fastened the buttons by herself. Because of this, she earns 1 point in independence for this activity. All right, Margaret, for the next activity, I want to see if you can bathe independently. Because Margaret needs help with bathing, I'm going to score her 0 points for this activity. Patients who need help washing more than one body part, getting in and out of the tub, or total assistance with bathing would receive 0 points. Gracie! Help! Because Margaret needs help with toilet transfers, she gets 0 points for this activity. Additionally, patients that use bedpans or need help cleaning themselves would also receive 0 points. Margaret, however, does receive 1 point for continence because she is in complete control of her bladder. Margaret relies on her granddaughter for help with transfers. Because of this required assistance, Margaret gets 0 points for transfers. Margaret depends on her granddaughter for help feeding. Because of this required assistance, Margaret gets 0 points for this activity. When scoring this assessment, the clinician would add up the sum of all 6 scores. A final score of 6 would indicate total functional independence. A score of 4 would indicate moderate impairments, and a score of 2 or lower would categorize the client as severely functionally impaired. Because Margaret received a final score of 2, she is categorized as severely functionally impaired. This assessment can be used to guide treatment and interventions and be returned to note the progression in her condition or functional improvements or functional declines. This assessment brings attention to problematic areas in the activities of daily living that we measured. Because of the severity of her condition, she may require a more comprehensive evaluation. This assessment is beneficial because it offers a brief and practical tool for measuring the basic activities of daily living. However, it does fail to account for the more advanced activities of daily living.